ladies and gentlemen, welcome back. Today we have this young lady who about a week ago dropped a footboard on her foot from a bed. She went to urgent care and was told it wasn't broken and no other treatment, correct? A week and a half later, she still has some swelling, some bruising, which is normal. Her skin is a little bit thinner, but when she came in today, I noticed a hematoma beneath the skin. So a hematoma is a collection of blood, and in the beginning stages, it's very liquidy, which is great. However, if we leave it and we do no treatment for it, it will start to coagulate and get thicker and thicker, and then it creates a void in her foot. It becomes very painful, and it can actually cut off blood supply to the areas down from it. So what we're gonna do today is we're gonna kind of pop into it and see if we can drain some of the blood out. That way we relieve pressure and we help to keep the tissues healthy. So, we look at her foot here, obviously bruising. I did new x-rays today and nothing is broken. You can see the swelling in this little focal area. Ultrasound does show a collection of fluid. When I squeeze, it still doesn't go past that line, so I can tell that there are borders to it. When I push in here, it squirts it all under this area. When I squeeze over here, it brings it more to a head. I'm gonna kind of go under here and see if I can't poke into it with a 15 blade, and we're gonna see if we can keep it from squirting the wall. All right, let's see what happens. We're gonna duck. That's what we're gonna do. Okay. I have been known to squirt blood across the room. All right, let me get this open and ready. And I'm gonna spray some cold stuff. There's my little X if we can still see it. So super, super cold. Up to freezer foot a little bit. Okay. Oh, so it's already starting to coagulate in there. I can feel it moving, which tells me I need to cut just a slightly bigger spot. I'm gonna move your foot over just so it's more on my tray. So you see now it's running down into this area where it was not going before. All right, so we're gonna cut just a slightly bigger spot so I don't have to torture her as much. Let's clean this off with Betadine again. And oh, sorry.
Right.
Let's put a drape over her real quick. Oh.
Fox said I'll take that off.
It will. You're correct. Yeah.
I use it a lot in sewing.
Yeah. So we have to kind of milk this away and see if we can. Oh, I feel it moving beneath my fingers more than anything. It is the neatest feeling to feel it crackle beneath my fingers and move. Whew. I'm gonna do one more little poke. Val, will you spray some cold stuff on there for me? Go ahead. Perfect. Woo! We about got Sarah that time. Hazard of the job. Look, so sticky. Once again, that causes a lot of issues if you don't get it out. It never fails. I wear white anytime anything cool comes in.
I just came in for a prescription.
Uh-huh. Yeah, that is what we call comprehensive care. Oops. All right, we're getting there. I mean, do you see that hole now? I mean, it was already eroding away into the tissues. Okay. I mean, this is really one of my most favorite things to do.
Especially in white t-shirt.
Uh-huh. It's all right. I've got clothes to change into. Thank you, ma'am. Okay. Now, did you see that red blood instead of the really dark blood? That's a good sign.
Let's get back to normal.
I know. No longer when I push in any area does it shoot it anywhere else. I don't feel it crunching beneath my fingers anymore. There was just a little bit. We won't get every single bit of it, and that's okay. This hole that we created will stay open, and it will continue to drain out for the next couple of days. So you'll have to dress it for me, just with a dry dressing. Okay, perfect. That's gonna feel so much better. You probably didn't even realize you were hurting as bad as you were, so. All right, I'll get Valerie to dress it or to clean it, put me a dressing on there. You'll do that every single day for me, and you're gonna come back at the end of the week and let me check on it one more time.
Okay.
Sometimes we have to poke it again, sometimes not. I don't
Okay.
think we're gonna have to on you, okay?